Wondering when prednisone is going to work to help with PMR, and when does it fully kick in? When do symptoms go away? If you are just brand newly diagnosed, what can you expect as far as how long you're going to be taking prednisone for PMR? These are great questions that I've been asked by many people, and I've learned the answers while I was at a Harvard Medical School seminar. So I wanted to share what I learned and give you an overview of what to expect while taking prednisone for PMR. I'm Dr. Megan, the Prednisone Pharmacist, and here are some of the things I learned and what you need to know about prednisone for PMR. So a prednisone warrior named Matt provided some questions that are going to frame my answer. And so I wanted to read his questions first so that you understand the context of what I'm trying to answer. This is what Matt said. Hi, Dr. Megan. Thanks so much for your PMR content. I hope it's okay to ask you a couple PMR-related questions. First, do patients often see a 100% or complete disappearance of PMR muscle symptoms when taking prednisone, aka getting treated? Or, as an example, do most patients observe a lower number of muscle stiffness, pain reduction, stiffness, like 75% or 50% reduction, for example? So that was his first question, is like, how much disappearance to expect? Second, how often do patients get their PMR into full remission when taking prednisone? And what is the average time for patients to achieve full remission of all symptoms? Thanks again. I was just diagnosed yesterday and I have a good doctor, but I'm also processing a lot. Any help you can provide is greatly appreciated. I hope this finds you well, Matt. All right, Matt. So like I said, I went to Harvard Medical School and I learned from Harvard rheumatology professors, doctors, the experts in the field. And these are some of the things I learned. So to briefly answer your first question is, do you get like 75% or 50% or 100%? Usually prednisone is a miracle drug for people with PMR, and it usually makes the symptoms completely go away. That's what most people experience. Let me read the exact words that the doctor used. He said, glucocorticoids typically lead to dramatic improvements in symptoms within the first few days. Other like actual words of people include like, it's a miracle. I can't believe it. I went from like, I can't do anything. I'm totally impaired. I can't even get out of bed without dramatic pain to I'm back to normal. Like normal PMR treatment with prednisone is amazing. It is truly a miraculous medication. So let's go over the typical treatment guidelines that you can expect for if you're diagnosed with PMR, then what? Then what? Then what? Okay. These guidelines were created by the European League Against Rheumatism in 2015. So they're kind of old. There's a lot that's changed since then, but the general strategy when it comes to prednisone and PMR is still the same. So first, you're diagnosed with PMR. And it's really important that this is a really good diagnosis, that lots of other things are ruled out to make sure it's not some other disease, because then what I'm about to tell you isn't going to work as well. So right at diagnosis, once we've made sure it's not other things, start prednisone. And the dose range is anywhere from 12.5 to 25 milligrams a day. Notice that's 25 or lower. Like it's not 40, 60, 100 milligrams. If you're getting that high of a dose, that's really too much for PMR. And it's kind of overwhelming, unnecessary, unless you have something else going on, like, for example, giant cell arteritis with your temporal arteries being inflamed. So then you stay on that dose, whatever your doctor prescribed, somewhere between 12.5 to 25 milligrams. Stay on that for 2 to 4 weeks. And then you gradually taper about 2.5 milligrams at a time until you get to 10 milligrams. So say you started at 20 milligrams. So then over 4 to 8 weeks, so you could drop by 2.5 milligrams every week or every 2 weeks. So you went from 20 to 17.5 to 15 to 12.5 to 10. And you dropped that far over a month to 2 months. Okay. And then at that point, you taper really slowly, about 1 milligram per month or even slower until you're off. So that means 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. That, if you caught the math there, that's about a year of treatment. Okay. That is essentially the minimum to expect from PMR. If you are able to follow that exact tapering strategy with no problems, count yourself very lucky, because for most people that doesn't really work, but that is the general strategy. So your second question, Matt, is how often do patients get their PMR into full remission when taking prednisone? So most people who take prednisone for PMR get full resolution of symptoms. Do they get fully off of prednisone? Not so much. What is the average time for patients to achieve full remission of all symptoms? So this is kind of an ambiguous question. Is it full remission with prednisone on board, or is it full remission with no treatment, right? So I'm going to answer the first one. Full remission because you're taking prednisone, like you're having these horrific symptoms, your muscle pain, your shoulders, you can't lift a cup, you can't do anything for yourself. You're totally, essentially disabled with incredible pain. That usually fully resolves with prednisone treatment, sometime between 12.5 to 25 milligrams. And if it doesn't, then either on you're too low of a dose, or maybe PMR is not the accurate diagnosis. One doctor has said that if prednisone works, you have PMR. Like if it doesn't work, you don't have PMR, is one way to simplify it. It's not necessarily that simple, but it's kind of a good distinction that prednisone works for most people with PMR. If it doesn't work, it's time to revisit that with your doctors, because it should work for pretty much everybody, or you don't have PMR. Let's finish answering the first way you asked about it. What is the average time for patients to achieve full remission of all symptoms? So there's not a lot of good research on this, but one case report showed a woman who had like weakness, muscle pain, dramatic, horrible feeling, went to the hospital. They did all these tests, gave her prednisone 20 milligrams. 12 hours later, she feels like fine. Her muscles strong and not in pain. 12 hours. That was it. That was all she needed. Whereas other people, it might be up to 2 weeks before they feel the resolution of symptoms. But for most people, it's within a few days. So that's why the treatment guidelines by the American College of Rheumatology and the European League Against Rheumatism says 2 to 4 weeks, you should be getting symptom relief. So it's anywhere from 12 hours to 4 weeks where you could be getting a symptom relief. But most people, it's really rapid. Okay, so then what happens if you relapse? If the disease comes back while you're trying to taper, then the guidelines say to increase to the lowest effective prednisone dose. So if you had started at 20 and you went to 17.5, 15, 12.5, 10, and you get to 9 and suddenly, oh, it's getting achy. You go back up to 10. Wherever you were and you weren't having problems, you go back up to whatever that was. So if you keep doing this roller coaster that I personally had to deal with when I took prednisone for a different autoimmune condition, if you keep relapsing when you're trying to get below a certain dose, then they say manage as refractory PMR and consider alternative treatment strategies. And that didn't used to be a possibility until the last 5 or so years, when new treatment strategies have come out. And I share those in a different video. Check those out. But who is at risk for relapse? So one study showed the higher relapse rate or being on prednisone for a really long time was most likely in females with a high ESR. So that was one of the blood tests. If it's over 40 when you're first diagnosed, you're more likely to relapse. And if you already had before diagnosis, what they call peripheral inflammatory arthritis. So if you have like wrist, finger, or other types of arthritis, you're more likely to relapse. Now, this information is a little kind of depressing about how likely you are to relapse if you have PMR. And that's why I was showing you at the beginning, this is the ideal taper, but it doesn't work for most people. These are the actual statistics according to one study. It said there's a high rate of long-term glucocorticoid, and when it says that, I'm just going to substitute prednisone treatment, is recorded in Polymyalgia Rheumatica, being 77% are still on prednisone at 1 year, 51% at 2 years, and 25% of patients with PMR are still on prednisone at 5 years. That's kind of sad. They said there's a pooled relapse rate of 43% at 1 year, which is remarkable. So the number of years you're on prednisone doesn't necessarily have to do with your relapse rate, right? Like you could just be prescribed prednisone long-term, and your doctor might not even trying to get you below whatever dose and trying to relapse, like trying to see if there's a relapse happening. But 43% of people in 1 year did relapse at some point. And so like basically had to go back up to the lowest effective dose. And several studies have attempted to identify potential predictors of prolonged treatment with glucocorticoids and relapse, but with inconsistent results. Basically, there's not enough evidence to show us why people are relapsing and like how to predict who's going to be on it long term. There's not a lot of good evidence, but the other thing I shared was women, high ESR and arthritis may, but it's just not good evidence. So here's 2 different arguments for and against using prednisone long-term, okay? So who should use prednisone long-term with PMR? Those who cannot tolerate or have a contraindication to other treatments. Like, for example, you've tried methotrexate and it gave you horrible nausea and vomiting and you just couldn't tolerate it. Yeah, don't bother even continuing methotrexate, just use prednisone. Or those who have optimized the use of long-term corticosteroids, it's going to be a lot cheaper to be on prednisone. Like if cost is a real issue to you, like you don't have insurance, you're not on Medicare, the other alternative medications can be very expensive. Like Actemra is tens of thousands of dollars a year. And then other people who probably have less risk for complications are those who have good glucose control. So you like have no family history of diabetes, you have a healthy weight and your healthy blood sugars. You have low cardiovascular risk, like no family history of heart disease, and then low osteoporosis risk. So you're not a postmenopausal female. If any of those things aren't true for you, then it's really not actually safe long-term. So here's the argument against it, okay? Another argument could say there are no scenarios where long-term use of prednisone is justified. And so all of these people should have caution against using prednisone long-term. Those with osteoporosis, diabetes, glaucoma, joint infections, uncontrolled hypertension, that's like high blood pressure, those with peptic ulcer disease, congestive heart failure, and active infections. Yikes. A lot of people have all of these things or some of these things. And the older you are, the more likely you are to have these things. And the older you are, the more likely you are to have PMR. So it's really tricky to find someone who doesn't have those risks and isn't going to have those risks nearly coming with their age becoming older. It's a tricky situation. So there were 2 studies to see how many patients with PMR got side effects that were like notable. There were 2 different studies looking back to see, for those who took prednisone long-term, how many got side effects. And it said that 65% of patients, which was specifically 81 out of 124 patients in one study, and 43% of patients, which was 95 out of 222, experienced at least one adverse outcome. And so basically these are people who had an infection, had broken bones, had heart disease, had glaucoma or cataracts, or many of the other 150 side effects that were bad. And so in one study, most people got side effects. In a lot of other studies, most people get side effects. It's not if, it's when you're going to have a side effect. Most people get them at the beginning, and especially as time goes on, the risk for heart disease, bone issues, all increase. So for those who are taking prednisone for PMR, I've given you a little overview of what to expect, some of the risks, some of the benefits. Like, it's amazing. It's a miracle, truly. And if you're thinking, wow, what can I do? I have a little cheat sheet for you. I call it my Prednisone Checklist. And it includes the top tips for what you can do about these many risks for complications. That there are things you can do to minimize your risks for having broken bones, having your eyesight worsen, having your heart disease worsen. That there are actual things you can do, you can talk to your doctor about doing. And I want you to be empowered to be able to do whatever you can to be able to take prednisone like you need to and not have to worry too much about it. And so I include those in my checklist. So there's things that you can do, things that your doctor can do, and then you can feel confident that you're doing exactly everything you can to minimize your risk for complications. Just click the link below to download my Prednisone Checklist now. Signing off as Dr. Megan, your prednisone pharmacist.